It's just really such an honor for me to be on this stage with three women that I admire so much, to be here kind of under the aegis of my beloved friend of many decades, Sarah Lewis. It's also especially meaningful to be here with Vision and Justice and at the Ford Foundation because in 2019, when Dr. Mona and I were together at a Vision and Justice convening at Harvard, I was pregnant with my third child. When I was here at the Ford Foundation at the inaugural Vision and Justice convening, I was pregnant with my second child. And when I went to watch Sarah present on her Coleman Fellowship project with the New York Public Library, I was breastfeeding my first child. And so quite literally, not only kind of emotionally and metaphorically, I very much feel in the most profound sense and with just ineffable gratitude. I'm mindful of how our lives have intertwined, and I could not imagine my life without her. And I think that her work has certainly helped our world kind of be illuminated for what we can be and so often yet are not. We heard in the video LaToya speak so powerfully about what motivates her work and about kind of why she felt so compelled to go to Flint. I thought we'd start the conversation with Dr. Mona, who really deserves enormous credit for kind of gathering the data that made the crisis in Flint inescapable, that forced kind of attention at the local and state level and also at the federal level. One of, I think, the kind of ways in which Dr. Mona has always been so brilliant is she's been deeply rooted in the evidence. That feels especially important to note these days when we're kind of talking about science, and always understood the power of storytelling. In fact, in a book that she wrote about her experience as a pediatrician in Flint in 2018, the title was "What the Eyes Cannot See," why we need data and storytelling to help peel back so often what are the most kind of horrifying realities that families and especially children face, including not only bacteria infection, but the longstanding crisis of lead in the water in Flint. And so, Dr. Mona, I wonder if you can start both by kind of taking us back to kind of where you were, 10, 11 years ago, 12 years ago, kind of in this work at Flint, but then also kind of ricochet us forward, because I know there's been some big news out of Michigan today.
Yeah, thank you, Chelsea, and it's wonderful to be back here at the Vision for and Justice convening. It's been an inspiring time to be here. It's been soul-filling, so thank you to everybody who's been part of this. As Chelsea mentioned, my book is called What the Eyes Don't See, and it's about what we've all been talking about all day. It's about this blindness, right, that we had and that we continue to have to certain people, to certain places, to certain problems. And I was a pediatrician in Flint, and I was caring for children, for babies, who people just turned their eyes away from, who didn't care about, who felt were disposable, and that the EPA said wasn't worth going out on a limb for.
Direct quote.
Direct quote. The EPA, when they said, hey, you need to treat this water properly, the EPA is like, but Flint's not a city worth going out on limb for. And when we found out this water wasn't being treated properly, and the EPA finally was trying to mandate the state to treat the water properly, the head of the water department at the state said, but who's drinking this water anyways? So when I heard about lead being in the water, it was, I could only see. When you know what lead does, when I couldn't sleep anymore. I couldn't eat anymore because we all know it's a potent, irreversible neurotoxin, a form of environmental racism, long-standing. It was the last thing our kids in Flint needed. So like Chelsea said, quickly conducted the research, which I never should have had to do because we knew there was lead in the water, but people were being denied, they weren't being listened to. Shared that research publicly, which is an academic no-no. That's not what you do as a scientist, but there was no other way because it was a public health emergency. And then was met with the backlash of the entire government, who was telling me I was wrong, telling me I was hysterical, telling me that my science was unfortunate. And at those moments, you feel like this big. I'm like, everybody's telling me I'm wrong. Like, maybe I am wrong, this sense of imposter syndrome. And it was the data, the science, that got me back in the fight, because it was a quick recognition that my data, my numbers, my research, every single number was a child that I probably touched in that last year, that I put my stethoscope on, that I asked, what are you gonna be when you grow up? Because I ask every kid that. And those kids got me back into that fight, and we fought back, and we're ultimately able to turn the story around, to make it an international story, so more eyes came to see this incredible injustice that was happening in the richest country in the history of the world, in the middle of the largest source of fresh water in the world, where an entire city of people were deprived from clean water. So from that moment to this moment, our work has not been to be kind of remembered by that crisis, but really to be remembered kind of working hand in hand with community. Our work has been to put into place a model of recovery, to inform national policy, get things like that infrastructure passed, which was the greatest investment in federal water. We got $20 billion to go to replacing lead pipes across the country. We strengthened laws, and the list goes on of all the goodness, the positive ripple effects. But it's also been about kind of redefining how we care for each other as a place that has historically been neglected, a place where, as we know, especially as physicians, a place where your zip code is the greatest predictor of where you end up. A kid in Flint lives 20 years less than a kid in another part of our county, and that is not unique to Flint, that is everywhere. So a lot of our work has been putting into place interventions to reimagine how we can care for each other. And Chelsea alluded to some joy that just happened today. One of the things that we've been able to put into place is a program called RX Kids. It's a prescription for health, hope, and opportunity. We heard a lot about hope today. And it is a nation's first. It's the first mom-baby cash prescription program, universal for the whole city. Every pregnant mama gets $1,500. Every baby gets $500 a month for the first year of life. For everybody, universal. We raised a lot of money. We started this in Flint. It got really popular. We raised more money. It's now in 11 cities, in 11 communities in Michigan. And at 1:30 today, Governor Whitmer, the governor of Michigan, signed our budget, which was delayed. We almost had a shutdown, mini shutdown. We'll not talk about the federal government. But she signed the budget today, and included in that budget was $270 million. All right. To eliminate poverty. We are literally doing the unimaginable. We are treating the pathogen of poverty for a whole state. We are improving health, but more importantly, we are making people see a different narrative, a narrative built on love and dignity and deservingness and trust, and fundamentally how we are supposed to care for our mamas and babies. And that happened today, and that is just amazing. It's amazing, amazing. The Flint water story was a crisis, an absolute crisis. But I share all this with you to also reiterate that out of that came incredible resistance. Almost a playbook on resistance, how to fight the status quo. And in that same spirit of fighting our poisoned water, we are now simply not okay with our babies growing up in poverty. It is that same resistance to status quo that I share with you that I hope that then you can kind of share in your communities as well.
Dr. Mona, one of the elements of our conversation backstage that really struck me was when you shared how much more trust moms in Flint now have kind of in their ecosystem, kind of trust for local government, trust for healthcare providers, kind of trust for community. And Dr. Uché, I know you spent a lot of your career thinking about trust, both when you've been a doctor, like examining and talking to your patients, and now kind of in your work outside of a clinical setting. I wonder if you could reflect on how you think about trust in this moment, either here in New York City, I know a place where we both kind of live and love, or more broadly?
Sure, thank you for that. First, I'm so excited to be here, just honored to be on this panel. And I want to say how important I feel it is that health is part of the conversation of the last 2 days, because if there is no justice, there is no good health, right? Like the two are intimately linked. And when Chelsea's talking about this issue of trust, and it's interesting because we're talking about it a lot in the moment, and I know some of you have probably heard and even experienced something called medical mistrust, right, or medical distrust. In my book Legacy, I actually like to kind of flip the frame. I call it institutional untrustworthiness. Because social institutions in our country have actually proven themselves untrustworthy to our communities. And what happens, in 2020 when there's a pandemic and there's a crisis, and we want people to get vaccinated, and they're like, wait a minute, hold on, wait, what? And you developed it in this, how much time? And they have so many questions, right? And they're looking for answers, they're looking for digestible information. But the problem is when that trust hasn't been there, how do you expect them to take your advice or recommendations, right? And so a lot of the work I do, and I talked to LaToya about this, is centered really around the community, right? Trusting the community voices, trusting that they have the solutions. And so I know that often when we talk about medical mistrust, Tuskegee comes up, or actually we should call the US Public Health Service trial, because that trial was actually commissioned by our government, right? And when you say Tuskegee, you actually take off the responsibility from our government. And we talk about Henrietta Lacks, right? The 34-year-old woman from impoverished Baltimore who went to Johns Hopkins with lower abdominal pain and had her uterine cancer cells removed from her without her permission. And then her cells were used by pharmaceutical companies and biotech companies, and they were used to make some very wonderful discoveries involved in polio vaccine development. But at the same time, she was never informed. She ended up dying. Her family was never informed about her cells being used. I used them during the
HeLa
first
cells.
HeLa cells. I used them during the first year of my medical school. That was in 2001. I was not told where these cells came from. We were just studying them. It wasn't until I was a practicing physician that I learned where these cells came from. And I was so betrayed as a practitioner. Another thing LaToya and I were talking about backstage is that, as a Black woman, I have my lived experience as a physician. I have one foot in one world and another foot as a patient. And so I had an experience during my first year of medical school where I was not listened to. I went to the emergency department with abdominal pain. I went 3 times over the course of a week to my medical school's teaching hospitals, and I was told I didn't seem to be in that much pain.
And Uché, where were you in medical school?
I was at Harvard.
Okay, you were at Harvard.
I was at Harvard, and that I wasn't that much pain. I was repeatedly questioned about my sexual activity, which, let me just say, initially is appropriate for a young woman with a lower abdominal pain, but I was questioned repeatedly. Like, what have you been doing? And I have to say, at the time, I kind of knew that this doesn't feel right. But it wasn't until I was a practicing physician reflecting back on, I think that shouldn't have happened, because I ended up perforating my appendix. I developed an infection, and I missed a month of medical school afterwards. And so when we talk about that trust, the trust also is that trust when you're going to seek care, that you're going to be listened to, right? And that when you're at your most vulnerable, the person that you're sharing that experience with is really going to listen to you. And I think that's the very least that we can expect from our health professionals. And so I do think there's a lot of work in this moment to engender that trust with communities. And so I think, there's several ways of looking at this moment. They're saying, oh my goodness, there's so much despair. But I also think this is an opportunity for us to reimagine how we interact with our communities, right? How are we thinking about how we provide care? Are we thinking about it being hospital-based or more community-based? Are we thinking about using community health workers who are lay professionals from the communities, who know the communities well, right? Who can provide education, prevention, so many different types of services. And we know from the data globally, and both in the States, that community health workers are effective. And so, yes, this is a moment for us to really think about what are the innovative ways that we can engender trust between our systems and our communities.
Thank you so much. Dr. Uché, I asked you that question on kind of the heels of what Dr. Mona had said, because clearly, a dozen years ago, understandably, there was very little trust. And there now is more trust because of the investments made, not only the cash investments, but as Dr. Mona can speak to, kind of the ways in which the system reimagined its responsibility and who was centered.
Yes.
LaToya, you clearly have not only spent time in Flint, as we saw in the video before we kind of came out, but also in many other places in our country. You're spending a lot of time, now in Washington, D.C., using your lens to ensure that we can't look away from either injustice itself or the responses to that injustice. I wonder kind of how your experience in Flint or in the other places that you've been all over our country have kind of elucidated your real opportunity to bring health into kind of the conversation, whether kind of the conversation is initially framed as kind of labor rights or union rights, kind of protesting human rights violations. How do you kind of think about your photography, your work, your voice as ensuring that we're also seeing it as a health issue as well as one of justice?
Yeah, it's a beautiful question. And yeah, it's an absolute honor to be here with all three of you. I watched your conversation, Chelsea and Mona, in 2019, and it was just really reaffirming and very confirmed, and just felt like I was there in solidarity with the two of you as you discussed what had happened in Flint and your work. So thank you for doing that. Also, Dr. Uché, it's so nice to meet you as well, and we'll touch on the CHW work too. So I want to answer that question by talking about my approach and method with Shay Cobb and Zion, and what actually has transpired since the 10 years, we're going on nearly 10 years that I've known little Zion. I met her when she was 8. She is now 18 in her 13th year of high school, because she's in a special school where they prepare them for college 1 additional year. And I want to touch on this to answer your question about how health appears, because I have a praise report to add on and run parallel with Dr. Mona about the result of what Shay and I actually did. So the photo essay was only 5 months. I stayed for 5 years. So was going back and forth teaching at School of the Art Institute and driving to Flint, working with Shay Cobb, Zion, and her best friend Amber Hassan, and all the artists that were there that I was working with in Flint, Michigan for 10 years. And that was documented and covered in Flint is Family in 3 Acts. It became a publication that was published through the Gordon Parks Foundation. It was the only reason why you can see the true story and what we did ever reach the light of day is because of that first book prize, thanks to Peter Kunhart Jr. and the Gordon Parks Foundation and Steidel creating that first book prize. So if you don't have that book at your school, your community center, or your church, you should definitely reach out to the foundation and get it, because it walks you through that entire time in terms of how we're using photography to, number 1, document and tell the story. That's Act 1. But then Act 2, which you're seeing here, with these beautiful images of them on their horses and seeing them on their land, that tells that hidden history. We bring it to light. How often do you hear the history about someone like Shay and Zion, though they're facing racism in the industrial north and a man-made water crisis, they're making the reverse migration back to the south in Newton, Mississippi, where their father amassed 90 acres of land, where they have their own fruit trees, their own Tennessee walking horses, and their own spring head. They have their own water coming from the ground. when I produced that first act, in the photo essay you saw, no one wanted to publish it. So I had to do it on my own time and my own dime, and we went and created those images because I believe that that's important for cultural memory, history, and helping people understand the reverse migration has been happening. And it's also a story about how we're learning how to live self-sufficiently off of the land, because we can't trust things that are happening to our food, right? Through the deregulation of the EPA, the FDA, where do we trust how we're sourcing our food? The third approach of Flynn family in Act 3, what I'm doing is standing on the photograph as the platform for social justice and equity, and that's when you see the atmospheric water generator. So to answer your question about images talking about health, what you see in Act 3 is that we work with Moses West, who created the atmospheric water generator. I go down to Fort Sam Houston, we transport it from Fort Sam Houston, from a military base, all the way in San Antonio, Texas, all the way to Flint. The technology was made by a black man named Moses, who's a retired Army Ranger, on that base. It mechanically creates condensation that allows it to generate 2,200 gallons of water per day. It's an endless supply because as you draw from the technology, it just replenishes itself. It's also laced with carbon all through it. So what you see in all those images of Acts 1, 2, and 3 of Flint is how I'm moving beyond documenting it as a photographer hired to do a photo essay to suddenly shifting into a patron, a philanthropist, an activist. They created an artist collective of men and women in Flint, all artists, that I became the mentor and patron of, called the Sister Tour. So a lot of these other images you see from Flint were used to raise the money so that I could send them to HBCUs across the country so they could really educate people about what was happening in Flint when it was no longer headline news. And so this last little kernel I wanted to give you to wrap up this question about showing and focusing on these images of health and how we used it as a platform to solve the water crisis is that one of the hidden things I was doing the entire time was the moment I met Zion, I knew that she was spiritually assigned to me. Because what I was able to do with her and her mother was what I couldn't do for myself when I was 8 years old in Braddock, Pennsylvania, when we went through a water crisis. And so when I met little Zion, I thought about Dr. Mona's research. And it's been reported between 6,000 to 12,000 kids were impacted by that lead contamination. Zion fits within that population. And so I said to myself, if I was able, as an artist, to work with galleries, museums, philanthropists, and foundations and collectors to raise the money where I could help at least one of those children be able to have access to their higher education and not have to worry about that and the setbacks from that lead contamination, that's what I would set out to do. And so in terms of a takeaway with making visual justice and connecting health, I want to also add in education. What ended up happening was Act 2 showed at SF MoMA, I believe it was 2019, an NG Jew show, Soft Power. NG spoke with me about it. We brought all the artists and activists from Flint to do a program. Also, I said to her, I would like to be able to address the board so that I could talk to them at their fiscal meeting about what we could do to ensure that I could help Zion and her mom with her higher education. She arranged for me to come to a luncheon. I sat down, she gave me 5 minutes to address them, and I told them, with this work here on view in the Soft Power exhibition, I would like for you, if you're going to acquire it, don't acquire one photograph. Please acquire everything here as a set. I left, and a couple months later, the gallery got in touch with me and said that the board moved to acquire it through the contemporary art department. And because of that, I was able to take the proceeds from that acquisition and open a 529 plan with Shay for Zion. So going back to the trust, health, and higher education and being able to move forward when you know the state tried to violate your body, your brain, your mind, your dreams, your future, if I can make a difference for just one, that's what I was doing as an artist, using my platform and standing on those photographs to combat that injustice, but to ensure that she would be able to move forward. And I just talked to Shay on the phone about a week ago, and she's about to sit down with Zion to let her know that the 529 plan resources are available. She's choosing 3 different schools in the state of Michigan, which is great because that allows the tuition to be a little lower so that that contribution is able to help her. And so that really came from being inspired watching your work, listening to your talk, and just being an artist and teaching other artists and my students. You stand on your artwork as the platform, right? If Gordon Parks is using the camera as a weapon, then in the 21st century, artists can use the photograph as the platform to get the equity, to get the social justice, to get the cultural change, to fight back against health disparities and health inequities. And that's what we were able to do by sticking together, not for a 5-month assignment, but together for 5 years so that we could impart that to Zion.
LaToya, what I think also is just so extraordinarily powerful in what you shared really is the vignette about kind of talking to the board so that they would collect all of the pieces. Because I think oftentimes when we only look at suffering, it's easier to think, oh, that's so terrible, period. When we're forced in the best sense to confront the arc of kind of the suffering, the resistance, the resilience, the joy, and the imagination of a different future, our responsibility shifts. Mm-hmm. And I think that's profoundly important. One reason I admire these 3 women so deeply is kind of both working at kind of the individual level, kind of to the patients and to the people who you feel responsibility through your practice, whether in a clinical setting or kind of through your art, and also working at a broader kind of community and systems level. And Uché, I know you've spent a lot of time both in academic medicine and thinking about how to improve in every possible permutation of that verb, academic medicine. I wonder, in this conversation, kind of health and justice, what do you think we should be doing to train our next generation of the clinician workforce?
Right, that's such a great question. And for folks who may know part of my story, I'm a former academician. In my prior life, I actually took a leap of faith and left my academic job to start my consulting firm, Advancing Health Equity, in 2019. So before the pandemic, before BLM, I knew that health equity was an issue that I wanted to address in closing the gap in racial health inequities. And so I think part of preparing our healthcare workforce to care for our patient population is really about telling the story and understanding the history. So how many people in here have heard of the Flexner report?
I hate it.
Okay, so as people, you may not know, but only about 6% of all physicians in the US are Black, right? 6%. And so you ask, why is that the case? But part of that is understanding the history. So the Flexner report of 1910, I'll say very, very quickly, but it was commissioned by the American Medical Association and the Carnegie Mellon Foundation. And they commissioned Abraham Flexner, an education specialist, to go around to all 155 US and Canadian medical schools and to assess them against Johns Hopkins, the gold standard here in the US and Western European schools. So to look at the percentage of physician scientists on faculty, what were the admissions criteria they were using, what were the laboratory facilities like. As you can imagine, in 1910, there were very few Black medical schools. There were actually only 7 at the time. And they had educated about 1,500 Black physicians by that time. And northern US medical schools were not allowing Black students in. So HBCUs were doing all of the educating. The report that Flexner came up with, and it led to the closure of a significant number of medical schools, including predominantly white schools, but it also led to the closure of 5 out of 7 of those historically Black schools, leaving behind Howard and Meharry. It's estimated if those 5 medical schools that had been closed in 1910 had stayed open, they would have trained between 25,000 and 35,000 Black physicians. 25,000 and 35,000 Black physicians. do you understand the impact of that in terms of the patients that could have been cared for, the communities that could have been served, the research that could have been done, the loss of brain potential in our community? That's what racism does. So it's understanding how the SCOTUS decision of 2023, right? How all of these, as it relates to higher admissions, understanding how a lot of the diversity pipeline programs that have been canceled by, at the NIH, how that is going to impact what our workforce looks like. And to understand that today, and actually not even today, I would say last year, it was more dangerous for me to have a baby than 30 years ago. Mm-hmm. Today, it's even more dangerous. So understand where we were last year, understand where we are today, understand the policies that got us to where we are today, and what we need to do to move forward. Because we need a workforce. We already know that racial concordance, when it comes to patients of color, it makes a difference. It shouldn't, but it does. We know that there are better outcomes when the patient and the clinician are from the same racial background, and especially for Black patients. And so we need to think about what do we need to do in this moment, because we know the domino effect. We've seen the domino effect from 1910 on today. What is the domino effect going to be 100 years from now? And then what's the impact going to be on our communities?
And Uché, how many HBCUs have medical schools today?
Only a handful. Only a handful. Definitely less than 10. Xavier's opening a medical school. Del State is opening a medical school, but definitely, I would say they're probably about four or five, right?
I think they're 4.
They're 4.
I think that's just an important,
yes,
not bookend, but data point. Mona, one of the things I admire about you is you're dedicated kind of through your, through the many roles that you've claimed for yourself, to train the next generation of physicians, of activists, of advocates. In this moment, since Uché thankfully brought us to this moment, how do you think about your responsibility? And since I'm being told we're going to wrap, I'm going to ask you and then LaToya to also then think about, and Uché, please feel free to chime in too, if I can invite the ire of the Ford Foundation. Doing so, how could anyone in this audience help you? Either kind of in the work for the here and now or the work for the future?
Thank you. I'm gonna answer maybe a slightly different question because it ties some of the things that we've been listening to. So I, as a physician, care so much about health, obviously, but have gotten so frustrated because I can't treat justice, right? I can't treat these big systemic problems. I feel like I Band-Aid them all the time. And I am driven as a pediatrician by one of my favorite quotes from Frederick Douglass, who we've heard about so much today, who said it's easier to build strong children than to repair broken men, right? It's easier to build strong children than to repair broken men. And that is 100% my work as a pediatrician. That's 100% of what my role as a medical educator as well. How do we make sure that we are building a workforce that focuses on the upstream whys so we can build strong children and not keep Band-Aiding and spend more money than any other country in the world on healthcare rather than on health and racial equity and economic justice. Those things are health. So I love these words by Frederick Douglass. A lot of my work now is about imagery and narrative and setting. So this new program for moms and babies is based on love. So we actually launched it on Valentine's Day last year. Do you guys know what Frederick Douglass's his birthday that he made for himself is? Valentine's Day. He chose Valentine's Day for his birthday. And Flint kid David Blight, who we also heard about today, he's from Flint. He's a Douglass historian. And he came back to Flint on Valentine's Day last year to sing happy birthday to Frederick Douglass in marking this moment so that we can all work together to think about how we can once again build a future for our children rather than repairing broken men. So I'm trying trying to tie all these themes that we talked about today, but for our future students, for our current students, we have to keep pushing them to ask the why questions. Why is this person sick and why is this person not sick? Why does this kid have a life expectancy worse than this kid? Why does this baby have a 10 times higher rate of having, dying in that first year of life, infant mortality, than this baby? And we can work to fix those problems. We absolutely can.
And what I heard is you should invest in her program.
Yes, yes.
You should all go to
Archkids.org.
Flint for
Archkids.org.
Valentine's Day.
Yes.
And for those of us who live in places outside of Michigan, we should hold up their example to our state legislators and our governors. And everything she said too. LaToya?
And what's the question I'm answering?
Answer whatever you want.
What do you want the audience?
Run the slides
what do you
again
audience
so I
do?
can tie it up in a nice bow with the community health work, right?
Okay.
Dr. Uché is
Yes.
talking about community health workers, and also this topic is health and justice. So if we get back to the slides where many of you saw the polls that were in that gallery room, it was gray. Well, what those are, and they're about to come up, those are 18 intravenous IV medical poles. It's medical equipment. I modified them to hold 4 photographs that are double-sided. And it is a 21st century workers monument. It's called More Than Conquerors, a monument for the community health workers of Baltimore, Maryland. They are the people who were on the front lines during the COVID-19 vaccine rollout with Dr. Fauci and many others. They were there, they were doing the work, but no one heard of them. When they kept talking about essential workers and we were in all of us were in lockdown, no one ever brought up CHWs. How many of you know what a CHW is? Just raise your hand for me real quick. Well, Dr. Uché eloquently defined it, so I won't redefine it again, but they are the liaisons, and they referred to themselves when they met me as the foot soldiers between the doctors, the healthcare system, and the health State Department of Health. And so they were doing that work, but no one recognized them. And then when I experienced being denied the COVID-19 vaccine, I reached out to Dr. Lisa Cooper, who she and I met in 2015 when we were brought to Baltimore on a panel where they asked, how could doctors, scientists, artists make useful art for America? Well, 7 years later, you got the CHW monument. And it happened because I was denied the COVID-19 vaccine. I called Dr. Cooper. She said, come to Baltimore. I want to introduce you to my mentees, Dr. Chidima Ibe, who specializes, her whole journey so far is her research is committed to CHWs, Dr. Anika Hines, who uses a methodology called photo voice to tell the stories with the patients on the ground, then get it in front of policymakers to impact legislation for health and justice. And then I met Tiffany Scott, who is the first CHW of Maryland and the co-founder of the CHW Maryland Association. And so I worked with all of them, and I'm breaking all this down to say, like, it takes all of us, right? My takeaway for all of you is it does take all of us. And artists can play a role where we're working with doctors, scientists, researchers, faith leaders, activists. We need that so much more than ever in this moment. If you think about health insurances going up 20%, 50% to 70% in 2026, we need community health workers. So another homework assignment, if you've never heard of them, I guarantee you, wherever you live, whatever municipality, zip code, state, they exist. They just continue to change their name. And I want you to keep them on top of mind and on your hearts, because when they were brought in for Johns Hopkins for that study during the pandemic, it was through funding that was given from the state to Johns Hopkins so that they could keep down the emergency room count of people using it as a doctor's office because they didn't know how to access or navigate our healthcare system. I'm also pointing this out because it's a labor rights and a civil rights issue. If the CHWs are working, being paid through grant money, they're not salaried employees. So what don't they have? Health insurance.
Yeah.
Isn't that ironic? On the front lines, dying from systemic, institutional, structural racism and an invisible virus, as well as fighting social determinants of health. And nobody knew about this, and they work for free, and no one said anything. So that is why you see Tiffany Scott
in the gallery in front of her own artwork talking about it. Then you see Reverend Hickman in front of her own portrait at the opening in New York talking about it, talking to people. And I worked quietly with the gallery and patrons and collectors to raise the money to get this entire monument sent to the Baltimore Museum of the Arts, which it arrived there the day that Sherrilyn Ifill and Jonna Comfort and I were honored at the BMA. That was the night before when those CHWs were honored in their own local national museum, brought in for the first time, seeing themselves on the wall, talking about the work that they did. So that is vision, that is justice, that is tackling health and justice, that's changing the culture, it's reshaping museums and institutions' relationships to artists, it's us standing on our power and unpacking that to leverage our creative resources and ingenuity to get wealthy donors and patrons to do what is right. I don't think it's an issue that billionaires and millionaires don't want to do things. I think it's that they don't know where we are and how to be connected. And when we do get connected, it is our responsibility and accountability to push beyond ourselves, to push beyond our own desires and make that change by sharing that platform. If you ever see the CHW monument that's now permanently at the BMA, the reverse side is actually photographs by the CHWs themselves. I trained them through the Notion family and Flynnis family how to make their own portraits, how to make their own photographs, and then tell their own story of what they're experiencing. And I share this to close out to say, it was commissioned by the Carnegie International, right? And what was interesting is that they gave it the Carnegie Prize. But the reason I did it and shared the platform with them was so that amateur photographers, amateur contemporary artists now have the Carnegie Prize.
I know we're over time. I also hope that you'll forgive us. I just think these women are extraordinary, and we're all the better for hearing kind of from them, from learning with them. And I hope there are people in this room who will support them and will join them. I think we are very much in a moment of deep crisis in our country. We are also in an extraordinary moment of opportunity, partly because we have leaders like and including these three women. Please join me in giving them a round of applause.
Thank you.